We've all been living with this law for the better part of 14 months. I hope it will not diminish your opinion of me to tell you that I've read this thing front to back twice. Now you understand the depths of my masochism. I can tell you it's way better than Ambien. It's not habit forming, that's for sure. I am convinced that there were buried in that 2,900 pages some noble aspirations, the noblest of which was to try and close what I think is an unsustainable gap in coverage in our healthcare system, and, by the way, create 30 million new customers for our physicians, hospitals, etc. But you know, as you make your way through the bill, through the thousands of pages of completely impenetrable legislative language, the animal that it most evoked to me was not that eagle. It was actually this blobfish here. This is a gelatinous deep-sea creature whose principal mechanism of biological defense is that no one wants to eat him. It works. I believe this was deeply flawed legislation. Far from being a federal takeover of the health system, it delegated an enormous amount of responsibility to states, which actually ought to be good news for TMA since you have an enormous amount of influence in what goes on here in Texas. But, you know, 33 of those governors are Republican governors, many of whom are really hostile to what this bill represents, and 26 of whom are suing to kill it. So, you know, the idea that we're going to have federal-state cooperation to make this happen is kind of questionable. I think the other part that's going to be challenging is the probably 30,000 pages of regulations that are going to be required to implement it. I've read a bunch of those as well. From a tactical standpoint, if you're going to do something this disruptive, the absolute last thing you want to do is to wait 3.5 years before the voters actually realize any of the tangible benefits. When we created Medicare back in 1965, it took 18 months before we began signing people up for the program. In Massachusetts, in 2006, when they enacted Commonwealth Care, it was 7 months between the governor signing it into law and people actually receiving coverage. Here, an eternity, 3.5 years. And I don't think the people that drafted this legislation had the faintest idea that the 2 election cycles that will elapse between signing it into law and people actually getting coverage from the bill will probably deliver control over both houses of Congress to the other party. You know, we're still mired in a recession. There are still the better part of 25 million people in the country either out of work or stopped work looking for work because there wasn't any. The absolute last way you achieve economic growth is by reducing the after-tax return on capital and by making it more expensive for small business to employ workers. It did nothing meaningful to reduce health care costs. And part of the reason why I read the bill twice was to make absolutely sure that I hadn't missed something. In particular, the failure to address our nation's medical liability crisis telegraphed to me that the pain and suffering in this legislation was not equitably distributed among all of the constituents that are driving health costs forward. And then finally, as we'll talk about, I believe it depends excessively on Medicaid expansion, perpetuating deep inequities and threatening state finances, even wealthy states like this one. It's also been an albatross for the Democratic Party. Far from selling itself, the number of Americans who believe that the country as a whole will be better off under health reform has actually declined another 7 percentage points since the bill was signed into law. And believe it or not, only 36% of the uninsured believe the country will be better off under health reform, the people for whom it was designed to provide them coverage. Now, there was a rather remarkable election last November. The people spoke, and loudly. And in the House of Representatives, an 89-vote majority for the Democrats turned into a 49-vote or 50-vote minority. There are 23 Democratic seats up for renewal, if you will, in 2012 versus 12 Republican. So there are a lot of people who believe that it's entirely possible that our next election the Republicans will control both houses of Congress, not just one. But I think, you know, if you're sitting there saying, well, what's going to happen to all of this stuff, it's not obvious that anything is going to happen in the ensuing 18 months. Because the Democrats do not have really enough power or political support to completely implement the legislation, and the Republicans do not have enough votes to kill it. And even if they did, it's far from obvious that they have something credible to replace it with. So we're in this funny place. I love this Godzilla versus the Smog Monster movie poster, because most of what's going to be happening in the next 18 months about health reform is waving the bloody shirt, trying to stir up anger in each party's base to try and generate sentiment to support the party's positions in the next election. And the very significant flaws in this legislation are not going to be addressed because neither party has any incentive to collaborate to fix it. So what I'm going to talk about this afternoon is, so what? What's lurking out there beyond health reform that we ought to be worrying about and thinking about, you as medical staff and medical society leaders, and me as a sort of a maverick advocate. And these are the 5 things we're going to talk about, and then some of the implications for medical practice. Would you invest in a company that last year had a $1.3 trillion negative cash flow and a negative net worth of $44 trillion? Well, they take checks. You're all shareholders in this company. And with each passing month, we are squandering our nation's sovereignty. And yet here, too, contrasting visions and even contrasting degrees of urgency about fixing the problem seem to suggest that we're not going to get serious solutions to those problems anytime soon. You'll notice that huge fight over reducing the budget deficit for fiscal 2011 ended up saving a grand total of $352 million. That's one of those Austin Powers, $352 million. The deficit in February was $220 billion. So we managed to save for the entire fiscal year that we're in the middle of a grand total of, I think, 0.6% of our total federal spending. And you know, it's really interesting. You know, there is a credible program to reduce that long-term deficit by many trillions of dollars that was introduced by Representative Ryan and actually passed the House of Representatives. But it's worth noting that the price is that the 30 million new customers, paying customers for your product, go away. They keep the cuts. They don't do anything about the sustainable growth rate cuts either. But, you know, essentially the positive benefit of health reform of creating all those new customers goes away. In other words, you know, at least in this vision anyway, we can't afford to reform the healthcare system, and it disappears into deficit reduction. And I think it creates a real dilemma for you who are, I think, and understandably, pretty upset with what was in that bill. The Medicaid expansion. If you priced out how much it would have cost to give 40-some-odd million people private health insurance coverage, the honest answer was about $2 trillion. Well, we didn't have $2 trillion. We didn't really have the $1 trillion that it ended up costing. But the way in which you got the maximum amount of people covered was by using the Medicaid program to do it. Almost half of the people that will receive coverage under health reform will get it through Medicaid. Why does that work? Well, for a very simple reason. It pays hospitals about 60 cents on the dollar in most places in the country to take care of Medicaid patients, and it pays physicians in fun bucks, basically. In some states, as little as 15 cents on the dollar for caring for Medicaid patients. Now, states were initially shielded from the cost of this expansion because the federal government was going to pick up the entire tab until 2016, when the anesthesia begins wearing off and states have to take on a portion of the cost. That's not the big problem. The big problem is that there are 12 million other folk who are eligible for Medicaid right now, but who are not enrolled. And when they are forced to have health insurance coverage because of the mandate in the bill, states will pay half the cost, plus or minus, of enrolling them. So, I mean, I don't know how you guys are having a Medicaid funding crisis in Texas, right? A wealthy state with, one of the healthiest large economies in the country. You're having trouble with your existing level of Medicaid enrollment. Where are we going to get the money as a society, states or federal, to add another 25 million people to coverage under this program? The numbers just don't work. So while a lot of people